welcome back, listeners, to the Mindful Living podcast. I'm your host, Sana, and as you all know, this is the space where we explore the intersection of body, mind, and soul on the path to healing and wholeness through mindfulness. Now, today we are diving into a topic that impacts so many of us listeners, whether it's through injury or chronic pain or simply the wear and tear of life: physical therapy. But we're not just talking about the ice packs and stretches. Today's guest is a physical therapist who sees beyond the pain point, literally, with a deep rooted understanding of orthopedic pain and a passion for uncovering the why behind the what. He guides people toward true mobility, healing, and sustainable body awareness. So, let's get into this powerful conversation about movement, mechanics, and of course, listeners, mindful recovery. So, meet my guest, David Jeter. So, David, welcome to the show, and I'm really, really excited to have you here with us.
Yeah, thanks so much for having me. I'm excited as well.
Okay, David, to begin with, many people, I imagine many people, they assume pain equals injury.
hmm
Some A specific point in the body is paining, so it must be connected with some injury. So your work focuses on finding the source, not just the symptom or the sign. So can you explain what that really looks like in practice?
Well, let me take a couple of steps back. If you go to your primary care physician and you say my knee hurts, that
Okay.
primary care physician has a really important job, and that is to make sure that there's not some really big, bad, ugly thing going on in that region. And that could be a whole host of things. That could be anything from cancer to a blood clot to some sort of neuropathy or any number of terrible things could be going on, and that practitioner should be trying to rule out most of those things. But once we have decided that you have sort of the itises, tendonitis, bursitis, arthritis, that sort of thing. Then you have a structure that is painful that has more of a mechanical nature involved, and we should start looking at that structure as the victim and not the culprit. And we should start looking around the neighborhood that that structure lives in and see if there are structures that are not doing their job in a way where there's more stress being placed on that painful structure.
Hmm. I really like the parallels that you draw. I really love the parallels. And um, are, are there any, any surprising example that you have seen where the pain and the cause, they were totally disconnected?
Yes, I mean, I have a saying around the clinic. I say the hip bone is the knee bone, and most everyone is very surprised um, when they come in with knee pain, and I start looking at how their back is moving and how their pelvis is moving and how their hips are moving. And we find that one or both of their legs is not moving well. And because it's not moving well, a lot of times there's a strength problem. A lot of times a restriction in the pelvis and hips and back can
Mhm.
create a weakness problem in the pelvis, hips, and back, and that can create a scenario in which the knee is not being supported during certain motions. And so most of the time when someone comes in for, say, knee pain, I would most of the time work on how their back and hips and pelvis are moving, and then start a progressive loading program to get that whole system to be able to tolerate it. And I think more often than not, people are surprised that their back and hip um, stiffness is the reason for that knee pain.
Wow. I think it's really a um, surprising and powerful shift, that each and every part is working in tandem with each other. I mean, like, seeing the body as a whole system instead of just a list of isolated parts. Um, and then, David, there's a growing trend around prehab,
Mm.
like this idea of training or preparing the body to avoid injury. Um, so, from your perspective, is proactive physical therapy effective?
I I really like the idea of asking the question, "What is musculoskeletal health?" And I really think if people start thinking about what does health actually mean, then they start asking themselves, okay, is pain part of that? Obviously, we want to be pain free. That is an important piece of musculoskeletal health. But that's not the only thing. I mean, if you do nothing, if you live in a saltwater bath and you just sort of lay in that environment, you probably are mostly pain free. But that's not function. That's not our daily lives. We need to have normalized range of motion through our joints. We need to have normal strength through those ranges of motions. We need to have good balance. We need to have good coordination. Um, so all of these aspects of musculoskeletal health need to be addressed. And when we start talking about physical therapy before surgery, there's a really, really, really good case to be made for doing it. And that case is, I'll give you an example. If someone comes in with a rotator cuff tear in their shoulder, which is a very common thing, um, a lot of times a lot of times the surgeons wanna tie that rotator cuff back down to the humerus, which isn't a that's not a terrible idea. But if we're not asking the question, "Why did that rotator cuff tear in the first place?" Or is there a reason why that rotator cuff tore in the first place? Then we're kind of missing the point, and there's no reason to believe that it won't re-tear in the future if we haven't resolved the reason for it in the first place. And a lot of times that reason has to do with how the shoulder blade is moving, and how the mid back is moving, and how the neck is moving, and how the collarbone is moving. And all of those things need to move properly to put the shoulder in a efficient place when it is especially moving overhead and out to the side. Because if your shoulder blade, most of us who have jobs sitting at a computer have this head forward, rounded shoulders posture, and that shoulder blade tends to get a little bit stuck in that posture. And if you leave your shoulder blade forward and then try to raise your arms, that doesn't go very well. If you have the ability to move through your thoracic spine into extension or sitting upright and then pulling those shoulder blades back, then you can get your arm overhead because the shoulder blade moved out of the way so that the humerus could move. And if you're constantly in this forward flexed posture and you're moving your arm out to the side and reaching and lifting with it, you're putting a lot of stress on that rotator cuff. And yes, it might tear, but the answer is not just to go in there and try to sew it back down to the bone and leave the whole neighborhood as it is. It is to get everything moving first and then do that surgery to tie it back down, and then you have a combination of mobility and then a repaired structure so that the post-surgical rehab is much more, it's just a lot easier. It's a lot easier to get things moving once, the person is done with, surgery if they have already gotten their mid back and shoulder blade and upper, ribs and cervical spine moving.
Hmm. And you brought a very, I was actually about to put up this point, because almost I think 3/4 of our lives they go in our workplaces or sitting down. Um, Now we are glued to our mobile and our laptop screens, and it's
Mhm.
kind of, I mean, I have personally adopted like a standing desk where I'm just standing and working. But um, do you think it is effective in the long run, or are there any proactive movements or channels or options out there, that we can actually adopt in our daily life, like maybe in the walk or the sitting?
Well, this is what I'll say is, if sitting, if you can just imagine the sitting posture and maybe kind of the worst sitting posture you can think of, where your head is very forward, your shoulders are rounded, your hips are flexed, and your knees are bent. You have to get the opposite of that some of your day. It doesn't have to be a lot of your day, but you have to get into that almost sun salutation, bending backwards, arms overhead, extended position through your spine. And if people really worked on hip mobility and mid back mobility and shoulder mobility, um, I think I would probably not have a job. I sort of joke and say, if everyone did yoga from the age of 5, I wouldn't have a job at all. Uh,
Oh,
and 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 also, but it's also not too late for older folks. When I talk to my 60 and 70-year-old patients, you know, obviously most of the time they're coming in for some painful thing that is going on with them, but I really emphasize with them that, okay, we're gonna get you moving today, or not today, over the next month or so. But the real gift that I'm going to try to give you is this program of mobility and dynamic stability and balance and coordination, such that if you do these kinds of things and incorporate maybe your tai chi and maybe your yoga and maybe your bar class and your Zumba class or whatever you want to do, as long as it's a combination of mobility, strength, coordination, and balance and endurance. Those people, those 60 and 70-year-olds, if they did that over say a 10-year period, what they'll find is maybe their function is plateaued and is maintained. But what they're going to see around them is a bunch of people where they're going to see a huge decline, and they're going to be maintaining their functionality. And that's a very important conversation that I have with a lot of my patients.
yeah, yeah. That really makes sense. Really makes sense, David. Um, Now, obviously, I would like to bring the element of mindfulness here.
Yeah.
Um, Movement. I mean, this is something that really, it kind of, it really piques my interest. So, do you think, David, that mindfulness practices, like let's say breath work or body scanning, do they have a real place in physical therapy, or are they more of a complementary wellness tool?
You know, I I am certainly a very mechanically oriented physical therapist. I am looking at things from a bone, joint, muscle, pulleys and levers sort of frame. But I also recognize, and I think it's incredibly important to understand that when we start talking about chronic pain, we're talking about changes in the central nervous system. So if someone's had pain for a very long time, it literally changes the brain. And when you've had pain for a long time, those circuits are almost wired such that they become um, less informative, and they become very easy to get to fire. So, when I start talking with my chronic pain folks, we start really trying to dial in about working with that breath work, and a lot of times, if people are very, very hypersensitive, that can be a very important piece in getting their central nervous system to calm down. And I think also, um, getting people to understand the idea that pain is not damage is a
Mm,
very important piece of my practice, and recognizing um, that a lot of times people feel some soreness or some stiffness or some discomfort, and their brain immediately goes to this fight or flight um, realm where that kind of overreacts, and that alarm system is a little bit too sensitive. And it seems
mm,
like with some mindfulness, we can start to get people to really think about, like, okay, how does this actually feel? Like, I know it feels uncomfortable, but is
mm.
this the kind of pain that I can work through, or is this the kind of pain that I need to stop and figure out, how to do something different?
Hmm. Yeah, I think it's almost like mindfulness. It gives it kind of lays a road, um, or gives a clarity of trying to hear what our body is trying to say, um, like tuning in with intention. And then I think it also helps in an organic healing. It could
Mhm,
be obviously a bit messy or maybe not linear, but of course an organic healing, not something which is forced. So
mhm. I
that.
I have I have one more thought on that too. A lot of times people come into my clinic and, I'm one of the first people that actually has them move around. If you go to a surgeon, half the time, it seems like they're not really even having you move around much. They're looking at your images, they're talking to you and whatnot, and they say, "Okay, well, on this image, this structure is such that I wanna go in there and cut around on it." So I'm asking people to move, and I'm asking people to feel their bodies. How does it feel when you move this way? How does it feel when you move that way? Does that feel different to you? When I'm moving their legs around, if they have low back pain or knee pain, do you feel this, do you feel how this leg moves well and this leg doesn't move well? And for most people, it can be very challenging for them to feel their own body and feel the way that it isn't moving properly. And I need them to feel that it isn't moving properly such that when I do my mechanical mobilization techniques, I can resolve some of that stiffness and then I can have them move again. And they say, oh, yeah, now that feels like I'm moving in that direction better than I was. But I can't tell you how many people don't have the ability, they don't have the mindfulness practice to understand, to feel how their body is actually moving.
Hmm. Yeah, I'll be even in fact I also will admit that it's the same with myself as well. Um, I have it's like automated. We are just walking or sitting, not able to. I'm not even thinking about my posture. I'm just concentrating on or kind of ignoring, even if I'm feeling that pain, but I'm like ignoring it because to me maybe it's not important in that moment. Something else is, but that does really take a toll.
But I think, when you start talking about people who are doing practices like yoga and other exercises, they're being intentional about their movements and they're trying to move in certain ways and they're feeling how their body moves when they move those certain ways. And that's a really valuable thing because, a lot of times I do get people who are maybe a little bit more athletic, and I have them move and I can point out that, "Hey, you're not moving on this side very well into this position." And they can say, "Oh, wow, that's really interesting that I can't move that way." And that the fact that I can't move that way is part of the reason why there's more stress on this other structure. I think,
Mhm.
so let me also put in terms of mindfulness,
Mhm.
um, I think it's really, I think it's really valuable to recognize that when we start talking about people feeling their bodies and the neuroscience behind pain,
Mhm.
and then we start integrating that and looking at that in terms of the mechanical, structural, physical, aspects. When I get someone to move properly, if I can, let's, I'll give you an example. If you turn your head all the way to your right, your
Mhm.
first rib, right, which is right by your collarbone, your first rib has to get out of the way. And a lot of times with people who have a little bit of that head forward posture, it's a little bit stuck to the side that they can't go. So I can get in there and I can wiggle that first rib and kind of free it up a little bit. And then what that allows is for the neck to move past that point. And when I can do that, what I am offering that person is sort of this temporary improvement in motion and decrease in pain because there's less stress through the system. And that in turn allows the brain to recognize that this movement is no longer a threat. And that is such a powerful thing is I can wiggle things around get people moving better, and decrease the threat level such that the person can mindfully recognize and acknowledge, like, okay, this movement is no longer a threat and I can move through this motion. And if I can teach that body to move through those motions, then I can bring the threat level down and I can get the person to recognize that this movement pattern is not a dangerous movement pattern. And once you can get that threat level down, then the person feels better more of the time. And then we can start doing a graded exposure of loading, of strengthening, such that the person has a combination of pain-free, non-threatening movement, and then we can progressively load it so that they can tolerate different stresses on the body so that their functional tasks during their day are not as challenging as the exercise that they're doing for maintaining their function.
That's such a good point that you brought up, David. Such a good point. And before we wrap up, I just want to bring in the aspect of surgery as well.
Mm.
Um, not demonizing surgery, but just it's all about empowering people to make informed decisions. That many patients, they are pushed towards surgery, as a quick fix. From your experience, David, when is surgery absolutely necessary, and when could physical therapy alone suffice?
Well, I always like to say that almost everyone should start with physical therapy. There are absolutely exceptions to that. You know, if one of my good friends who's a physical therapist had a motorcycle accident and he had a burst fracture of L4 and he ended up with an emergency lumbar fusion of L1 through L5. And so that's a really good reason to have a surgery is if you have a motorcycle accident and you have a burst fracture. For sure. You're going to need to have surgery if you want to not be paraplegic. But then I get other people who have had shoulder pain for a year and they have all of this postural stiffness and weakness and poor coordination. And I think to myself, okay, what would happen if we changed the neighborhood in which that painful structure lived? Would that significantly change how that structure feels? And I would argue most of the time it does. Now, if it doesn't, if we get the person moving well and we get the person stronger, but they still can't do certain tasks because that structure is either not intact or is inflamed or for whatever reason, then that person becomes a very good surgical candidate, right? If you resolve the biomechanics of the whole system, and that structure is still problematic, that person becomes a very good surgical candidate. And then, then either the surgeon can do some sort of repair where they're tying a structure back to another structure, or something I call a buff and wax, which is where they just go in there and they cut out the inflamed tissue. And there are times and places for both of those kinds of techniques. I mean, I'll give you another example in the low back. If you have um, if you have bowel and bladder incontinence, you should definitely go to the ER and they will probably consider doing some sort of surgical intervention on you because if you don't take care of that problem, if you don't decrease the stress, that pressure on those sacral segments, then you could have incontinence for the rest of your life, which would be a really terrible thing. So, yes, I think the question, like if we take that 30,000-foot view, though, we should always be asking the question of any treatment. I don't care if it's a Tylenol, I don't care if it's brain surgery, I don't care if it's a physical therapy, mobilization. We should ask the question, we should always be asking the question, what is the likelihood that by performing this action, that it's going to change the system in a way that's going to be beneficial for the patient? And that's the thing that I feel like is a little bit lost in the medical system is asking the question, what is the likelihood that this is going to positively impact this situation? And if you really ask practitioners that question, a lot of times they get real wishy-washy about like, I don't know, maybe it's gonna help, maybe not. And it's like, really? Are we gonna put a hole in somebody's body and dig around in there and cut something out and maybe put some, metal or plastic in there or sew something down? And there's only a who knows chance that that will improve the situation.
Hmm. Well, mm, I appreciate your honesty in there, David. I think um, definitely it depends on situation to situation, but of course, physical therapy is something. It's kind of prerequisite in there. So before we wrap up, if our listeners they would like to connect with you, David, to explore more about the benefits of physical therapy, the benefits of mindfulness movement, what would be the best way?
I have a Facebook page which is Start with PT, and that just kind of goes through some of the ideas and examples that I've put down. Just a place where I talk about why people should start with physical therapy and what um, what our goals and what our ideas are about why improving musculoskeletal health is the way that we resolve musculoskeletal pain. So start with PT at Facebook is a good place to find me. Our website is accelerationphysicaltherapy.com, and you can find me there. And if you're in the Spokane area, then hey, we'd love to see you and get you moving.
Wonderful. I'll make sure to have all the links in the show notes for our listeners. And David, thank you. Thank you so much for this really practical and insightful conversation about pain and physical therapy. Although it is uncomfortable, but let's look at it as our body's invitation, like a call to slow down, realign, and return to ourselves. So, thank you so much for bringing both science and soul to the world of physical therapy, David.
Well, the pleasure was all mine. Thank you.
So, to all the listeners out there, um, if you are feeling stuck in your body, unsure of your next step, I hope that today's insights, David's insights, offer hope, direction, and a little more compassion for the process. Until next time, I'm your host, Sana, and this is Mindful Journey, your space to heal forward. Thank you.